The best time to do your breast exam is right after your period. This is when you have the least amount of swelling in your breasts and when you're going to be able to feel the most deep tissue in there rather than swelling or fluid. So take a look and do your breast exams every month. In the privacy of your bathroom, strip to the waist and stand before a mirror. You will need to be able to see both breasts at the same time, and stand with your hands on your hips and check the appearance of your breasts. You want to look at the size, the shape, and the contour. Press your hands firmly down on your hips. This helps you notice any changes in shape, contour, dimpling, or redness. You want to make sure to look at your nipples and areolas and see how healthy they look. Standing in front of your mirror, raise your arms over your head and see if your breasts move in the same way, and note any differences. Look at the size, shape, and drape, checking for symmetry. Pay attention to your nipples and areolas to see if you have any dimples, bumps, or retraction, which is an indentation. Look up towards your armpits and see if there is any swelling where your lymph nodes are, which is in your lower armpit area. The next part of your breast exam should be done in the shower. Using water and soap helps relieve friction between your finger pads and skin, making it easier to feel deep inside your tissue. We're going to make sure to check the entire breast, starting from our clavicle or our collarbone and going all the way down to where we feel only ribbed. We want to move around the breast in an up and down pattern, starting at an imaginary line drawn straight down from your side of the underarm and moving across to the middle of the chest bone. You want to use the pads of your fingers to feel for lumps in the breast. While you're doing this, you want to use 3 different levels of pressure to feel all of the breast tissue. Light pressure is needed to feel the tissue closest to the skin, medium pressure feels a little bit deeper, and then the firm pressure feels the tissue closest to the chest and ribs. It is normal to feel a firm ridge in the lower curve of each breast, but you should ask your doctor if you feel anything else out of the ordinary. The last stage of the breast exam should be done in your bedroom where you can lay down. Place a pillow on the bed so that you can lie with both your head and your shoulders on the pillow. Lie down and put your left hand behind your head. Use your right hand to stroke the breast and underarm and take note of any changes in texture, color, or size. This part of the exam is done while lying down because when you lie down, the breast tissue spreads evenly over the chest wall and it's as thin as possible, so it's easier to feel all of the breast tissue. During your breast exam, you may feel nodules or glands. Some of these are completely normal. A great idea is to talk to your doctor during your annual exam and make sure that you know what you're feeling. Use that as a baseline for your future self-exams. Even though a breast exam can be frightening and intimidating, you've got to do it every month. Promise me you will do your breast exams every month.